Hey everybody, talking a little bit more about does this patient have Morton's neuroma? Classically, when patients will come in, they'll say you'll be able to see straight away that their second, third or third, fourth toes are slightly more open, and that can be a sign that the Morton's neuroma has caused a little bit of entrapment in the area and really started to display those toes. It could be also that because of the pressure there, that it's just torn those plantar plates a little bit, which has opened up that space due to the size of the neuroma. But they'll come in and they'll say, I've got a marble or a rock sensation underneath the ball of my foot or my forefoot, and straight away I'm thinking, okay, it's more than likely going to be Morton's neuroma. When they then add that there's numbness, burning, shooting or tingling into the toes, so very nervy or neural type symptoms, that's when I'm going to be more and more likely to be able to say, okay, that's more than likely a neuroma in that area, or at least some nerve entrapment. On ultrasound and x-rays, we may be seeing a few different things. On ultrasound, it's going to come up nice and clearly as a neuroma bursal complex. And on x-rays, we're really wanting to see whether though that metatarsal parabola or the relative lengths of all the metatarsals are appropriately, in a nice parabola, rather than, and we've got a ratio around that we're looking for, rather than say a third metatarsal that is the same length of the second metatarsal. It's more than likely that there could be a few different things that are causing concerns there, and this will definitely help in how we're treating our patient when we get through to that as well. There's a few really simple assessments that we can do. A Mulder's click is where we do a medial and lateral squeeze whilst also trying to feel for that Mulder's click there. And that's going to be really diagnostic. It's about 90% positive if you're able to produce that click clinically. And when we're seeing that, we're very happy that it's more than likely going to be a Morton's neuroma. Our other one is our Mulder's test, where we're just going to be pushing through that area where the neuroma would be, and that sort of typically that third, fourth interspace, where we're typically seeing those true Morton's neuromas, and that's going to be positive. It may reproduce symptoms. They may say that it's a bit achy or sharp or throbbing when we do that, and that's going to be quite diagnostic as well. But the main thing here is also the exclusion of differential diagnoses, because in the forefoot, everything's really tight. There's a lot of structures around very local to each other. And so we need to make sure it's not those. And we'll talk about that in one of our other videos. In the meantime, hit the subscribe button, put any comments you'd like, or have a bit of a look at some of those videos here through our other conditions. Cheers.